So I'm often asked by patients who have an EGFR mutant, what are my treatment choices and is immunotherapy an option? And I often talk to patients that this is a situation where we can truly use personalized medicine and use a precise TKI that can target the driver mutation for their cancer. So I talk to my patient about using osimertinib, not only for the progression-free survival advantage, but for better tolerability, for the survival advantage, as well as for the improved intracranial response to treatment. I also counseled my patient that there is no clinical trial that actually shows that immunotherapy is beneficial for patients with these mutations. There was one clinical trial that showed that patients with EGFR mutant non-small cell lung cancer may in fact not benefit from immunotherapy. And additionally, there is accumulating evidence that if we start with immunotherapy first for patients with EGFR mutant non-small cell lung cancer, that there may be a higher rate for immunotherapy-related adverse events after a TKI is introduced. We recently saw overall survival data from the FLAURA trial. Previously, we had seen progression-free survival improvement with the use of osimertinib in the frontline setting for metastatic non-small cell lung cancer. The use of osimertinib was associated with a progression-free survival of 18.9 months compared to 10.2 months with the use of erlotinib or gefitinib. Most recently, we saw that osimertinib was associated with an improvement in overall survival with a median overall survival of 38.6 months, which for the first time is the first trial to show an overall survival advantage with the use of an EGFR TKI in the frontline setting. This was also associated with higher and superior tolerability with this drug. The final results from the FLAURA trial were recently presented and subsequently published in the New England Journal of Medicine. 2 years ago, we had seen the progression-free survival data where osimertinib in the frontline setting for patients with EGFR mutant non-small cell lung cancer showed improved outcomes compared to first-line erlotinib or gefitinib. We saw progression-free survival of about 18.9 months compared to about roughly 10 months with the use of other TKIs. Based on that information, we had begun to use first-line osimertinib based on the superior tolerability and the significant improvement in progression-free survival. Most recently, we saw overall survival data with the use of osimertinib, and the results confirmed a survival benefit. Not only that, the final analysis continued to show an improvement in CNS penetration as well as superior tolerability. This is the first time that a TKI has been shown to improve overall survival in the frontline setting, and therefore I have been using it as my first-line option, and the recent data further consolidate my approach.